over.
193 emergency. What's your situation?
Please help me. My wife is having a baby. I need an ambulance now.
Sorry, sir. We don't have any ambulance in your area. You need to get yourself to the nearest hospital on your own. We are very sorry, sir.
Okay, I take her on my bike.
Good evening and welcome to the Maternal Health Channel. In this program, we report on some good news, news that illustrates the small positive changes that can grow into big ones. A story about Shawana Mohammed, a young woman from Kpalbe in the northern region, featured in The Lights Have Gone Out Again, the documentary that inspired the Maternal Health Channel television series. One of the major challenges inhibiting improved maternal health services across Ghana is the non-availability of emergency obstetric care services in remote health centers and the uneven distribution of skilled personnel. In the northern region, for example, one doctor attends to 74,000 inhabitants compared to one doctor to 10,000 in Accra, Ghana's capital city. The odds were clearly stacked against Shawana, but she witnessed changes in the maternal care services in her area, which has brought her some happiness. In The Lights Have Gone Out Again, she's about to deliver after having lost a child. She's fearful and anxious and hoping against all the odds that she delivers safely. Let us take a look.
Dawn breaks over the village of Kpalbe in northern Ghana. Iman Mahamadou lifts his voice and prays for a good day. Shawana, his daughter, is also up early. She's 7 months pregnant and due for a checkup at the local clinic. Before she goes, however, she has groundnut biscuits to get ready for the market. Shawana's parents decide to accompany her to the clinic. She lost her first child and she has not been well lately. Her father also lost his first wife during childbirth. It's an anxious time for the whole family. Shawana is attended to quite quickly. Her parents look on anxiously. In the examination room, the midwife takes Shawana through her checks and reassures her. It all seems fine, for now. Abiba Hussaini has run this clinic for many years now. She keeps a cheerful demeanor, but it's not hard to detect the many challenges she faces daily.
The bed is rusted due to the bleeding and other things that go under it. You can see it by yourself. We need 2 delivery beds. We also need a resuscitation table.
The clinic has no running water. Everybody here relies on buckets of water.
When I'm delivering a woman, I have to walk out to wash my hands, come back here and attend to the woman.
Kpalbe Clinic is not equipped for emergencies. That is taken care of at the district hospital 30 miles away. There are no ambulances here.
We have just 2 motorbikes. We normally find it tough when we are referring our mothers. Salga Road is bad. We prefer referring our mothers to Tamale. Baba, you ride carefully. You support them. Bye-bye. How Sanu?
Now we're back to her hometown to find out if she in fact had a successful delivery. Shawana not only had a successful delivery, but has since added another baby to the family. Her father, Imam Mahamadou, is also pleased and raises his voice in praise of his family's good fortune. It's a happy time for everyone. Things have really turned out well since our last visit. Shawana says she would like to have 5 children. She now has 2, so 3 more to go. Shawana says no, 2 because she is also counting her first child who died after she gave birth. It's a personal belief, but it resonates well within Dagbani culture, and the whole family respects her for it. To get more of an insight into what has changed in Shawana's life, we take her to her local health clinic. The outside environment looks the same. Inside, there is still a friendly face. Mrs. Mensah, the midwife in charge, is pleased to see her. She quickly spots a boil on Shawana's daughter and promises to take a closer look later. One very visible change is the brand new delivery bed. Here also a small tank in place of the buckets of water fetched from the compound. Soon it's time to return home. Shawana and her father warmly wave goodbye, acknowledging a place that has come to mean so much in her life. One of the challenges confronting Kpalbe Clinic is power cuts, which has a multiple effect on the quality of health delivery there. We take a look at the situation 4 years ago and recently when our roving team returned to Kpalbe.
Abiba is about to deliver a baby, but one challenge seems to get her down. No matter how hard she tries, power cuts. The lights have gone out again.
This is the only way I can help her.
The clinic's solar panels barely work during the raining season. Thankfully, there's good old torchlight and lantern.
There is still no adequate electricity supply at Kpalbe Clinic.
We have to use a torchlight to conduct delivery at times in the night. We still don't have an ambulance and it makes referral very difficult. We only have motorbike, and when there's a referral, we have to use the motor or call a taxi in Tamale to come to this place to refer a case. And it's making the work very difficult for us.
Hello, good evening. My name is Notidu and you're welcome to our discussion segment. We'll bring you closer to the issues. And with me in the studio, I have on my right, Nihad Mensah, midwife in charge at the Kpalbe Health Center in the Northern Region. Nihad, you're welcome. Next to me, I have the lovely Shawana Mohammed with her daughter, Amama. Shawana, you're welcome. Next to me, on my left, I have Seidu Isahaku, who is a community health advocate also in Salaga in the Northern Region. I'm going to say welcome in their language, Dagbani. Amaraba. From the documentary. Shawana was a worried, expectant mother, right? Now we see her, she's a happy mother. She has 2 children, very happy with herself. But what makes her happy? Is it just the 2 children? Can she explain to us and share with us her happiness?
Dr. Mani Boye to Asharinella, Binda Kana Kpalbe, Lasa, my soup pale. Ama Pumpo Binya Zungoma, Allah make a soup pale, Bozo.
And that Russia carcana, didn't there some also. But then I can drop the cars and then check out so back.
I delivered the first one.
Okay.
The baby died, and I have 2 children, and I'm happy.
She actually has Amama here, who is 8 months, and then Fatima, who is around 4 years. What are some of the changes that you've experienced at the clinic?
We used to have this raster delivery bed, which when women deliver, they carry infection home. But now we've had a new one, a new delivery, a modern one. And the women are always comfortable. We didn't have Veronica buckets. We used to use a bucket. You wash your hand and raise your hand in one. But now we have Veronica buckets, a rubber bucket. It's a design one, and there's a tap. You have to open
so like a
and then
dispenser.
yes, open and then wash your hands. And then we now have examination beds. We palpate the woman on. But first, we didn't have all these things. We have our delivery equipment, and it helps the work go on smoothly.
Right. To many people, these sound like basic, small, petty things, but they've made a significant difference in the lives of the people of Kpalbe, as we see with Shawana here. But we know also that despite these changes, life-saving changes, if I can say that, there are some things that haven't changed.
We don't have an ambulance for referring cases to the nearest hospital. We have about 42 communities, and they all come to Kpalbe. Some come with this complicated, and when you want to refer a case, you have to use the motorbike or call Tamale, which is about 30 miles away from Kpalbe, for a taxi to come before you can refer a case to Tamale.
So even when you call Tamale, it's not an ambulance, it's a taxi.
It's a taxi.
Right, which may or may not be available.
Yes, please. And a woman in labor sitting on a motorbike for about 2 hours to a hospital is a risky game. We don't also have electricity. We have to use torchlight in the night to conduct delivery. And you can carry infection to the woman. You, the midwife, you can also carry infection. And then we don't have staff. We are only two, one midwife and a community health nurse. No starving, and then no accommodation at the place. We only have 2 cottages.
There's still challenges at Kpalbe, despite the good news that we're bringing you. There are 2 of you, a midwife and a nurse, and you run a 24-hour shift.
We run a 24-hour because I'm the only midwife.
Seidu, you've been doing a lot of work, and you're very close and familiar to the story and the family of Shawana. And I'm sure you can share with us some other aspects of her joy, why she's happy.
Well, I've been with Shawana for so many years. I know her mother, I know her father. The first time she went into the pregnancy for the 9 months and delivered and lost the baby, made her frightened. And later, when she had a second pregnancy, she was able to deliver safely. So in fact, it made her happy once she's able to deliver and get all her 2 children alive. That made her very happy.
Right. Thank you, Seidu. Indeed, you've known her for some time, and now she's 25, and she has 2 children. But she tells us in the documentary she's actually looking forward to having 5 children. Shawana, why 5 children?
Well, I'm so Kpalbe.
So then come and Bummin do Asham car the Tapala.
That I first delivered one and she died. I now had 2 children. And out of these 2, if I don't give birth to more and some died, that means I'm going to lose, so I have to.
So she's happy and she wants more, right? And she seems to want them pretty soon. But what about family planning and spacing?
Yeah, I now bora be no. I won't do sensible.
Is it something she considers that she thinks is important?
And Lema, the viola be the viola. That is good.
It's good.
But the family planning is good.
So if I suggested to her that maybe the 2 more she's asking for is too much, would she slow down?
Ni uncle yela ni maybe bia yima viola the lands and shalempai and wom.
No.
Yes.
She'll slow down a bit.
She'll slow down.
All right. But you can see that she really wants more children. Let me switch and ask you. I mean, we encourage women to have their children at the health facilities, attend antenatal and get all their support services. Is this happening? Are you seeing more women coming to the clinics?
No, please. And looking at the nature of our roads, they are bad. And where the clinic is too far from some of the villages. And at times poverty too. They want to come to the clinic, no money to buy fuel into their motorbike. Access,
right.
So they always find it difficult to come to the clinic to deliver. But ANC, they come to the antenatal all right, but to deliver at the facility is always a problem.
Okay, so we still have some more work to do with health education, getting them to take up these things. Right. Sister, I can understand the joy and the importance that women attach to having more children, but how are they doing with regard to family planning? Are they taking it seriously? Do they come to you for those services?
They don't actually come for family planning services. Just because they think they have to give birth to more children to help them in the farm. So we still educate them to come and then do the family planning.
Okay. So the future changes and what you need. I hear you saying, well, you could do with more staff. What else should we be looking for?
Yeah, we need an ambulance. We'll be very happy. The community will be very happy if we get an ambulance to refer cases. And then no lights. A woman will come, you have to use a torch. You have to suture. And you use the torch, you have to put the torch light in your mouth. And at times, you'll be doing your
You have a torch light in your mouth whilst you carry out
the
life-saving professional procedures.
Yes, please. And it's not only Kpalbe alone. Almost 80% of the clinic.
Right. But my understanding was that you had a solar plant. Does that not help?
Yeah, the solar plant, during rainy season, at times, it will not work.
Okay.
You put it on, it will blink, and then it will go off. So you have to use
So you need electricity.
We need electricity.
Staff.
Or a generator that can help.
Let me also ask about this, practice where women, because we mentioned unsupervised deliveries, are using calgutim. I understand it's a locally produced herbal agent that induces contractions. What's this practice? You're aware of it, I'm sure.
This calgutim is a local oxytocin. It's made up with herbs. And these women take this calgutim to induce labor so that the labor will be faster. And they will take it overdose and at the wrong stage, because even the local, the symptom we give, we have the stage that we give, but they will take it and they will start, the uterus will start contracting, and before you realize the woman has ruptured. And they will bring this ruptured uterus to the clinic.
To you?
To me at the clinic. And they will come, you have to refer, no means, in the night.
So the use of this calgutim really poses a challenge to all the good work you're doing and all the progress we are reporting today.
Yes.
Right. And are you able to discourage the women? It looks like it's quite a widespread practice out there.
Yeah, we give education, we help debates, all the opinion leaders, we talk to them. But it looks as if because some of the communities are far, they can't come to the clinic. So they think when they take it, it will help them during labor, but it's causing more harm than good.
I'll come to you, Said, because this is also your territory. But I'd like to ask Sister, if you can ask Shawana, if during any of her pregnancies, anybody had suggested or whispered calgutim to her?
Me, and I and drama, so yella ni anyu calgutim biela baby wula.
So yeah, na dama nan calgutim ma ka do ayinga. Kan ye ai min cha ashiptana. Ka do atata zam kan do ashiptana. Ka bishani cheka ba cheka ta nyorla yanga dama ai nyujinga an do ayinga ama amba nyuba ka ku cha ashiptana. Do atani yendi ka ba bishaka ashiptana aship lat kana. Ama do ayinga birin nan ta na ka nyujinga ban dafur la zakara ne ka do ayen zanna cha ashiptana ya adanya po zanka. Then check a shave and you're a calcotton, Kalanji, I shipped and the moon will young won't try.
That when she was pregnant and she was in labor, one of the family member gave her the Kpalbe to take.
Okay.
So that it will fasten the labor. And she said she will not take. She would rather go to the clinic and deliver. But most women take it in the house so that it will help them to deliver.
Okay. Seydou, I hear this is quite cheap, widely available. Sometimes you can even get it free. She's been able to resist. How do you see the challenge posed by some of these traditional remedies, if I can call them that?
With these traditional remedies, this in terms of this carotene, you know, they don't buy. The man will just go to the farm, look for the herbs, and prepare it on the farm, and then bring it to the house. Okay. So anybody who knows that Mr. A is having carotene, when the fellow is about to deliver, you see, they will just say, you go to Mr. A and ask for this thing. And in fact, the way they normally even take it, it's not measurable. Then the quantity they will just fetch, you just put it in the porridge, you take it. Some you grind it in a powder form, so just to give to the woman to take, and then she can deliver in the house.
Right.
And when there are complications, then they will not say, let's carry her to the midwife.
Right. So. We're celebrating good news, but there are still challenges. A motorbike designed for two, taking not just two, the rider, the pregnant woman, making it 1.5, maybe 2 if she's carrying twins, and another passenger, which strips and robs the facility of one personnel because there are only 2. These are the challenges we're looking at as we celebrate the good news of Shawana, her 2 children, and sister is here. We also want to celebrate sister specifically because she's one of the few hardworking personnel who will accept postings to such remote areas. Sister, I don't know how we can thank you, but we celebrate you today and the good news you've managed to bring to Shawana's family and the community you work in. We thank you very much. And to Shawana as well, there's a lot that is changing, but she's testimony to the change and the progress that is possible if we educate people. I want Shawana to know that we celebrate her as a voice of the voiceless in her community. If you can tell her that. How do I say thank you? So. And to Seydou, I mean, community work, advocacy is always a lonely road. We've undertaken to do that as well on the Maternal Health Channel. And we know it's difficult, the bridges with the district health management team, all the challenges with resources and so forth. We congratulate you as well on your good works, and we will partner with you as we look to the challenges and the remaining issues that have to be resolved. Thank you as well.
Thank you very much.
Right. I'm so elated and I'm so happy with the good news we've been able to deliver on another interesting, revealing discussion on the Maternal Health Channel, where we seek solutions and save lives. And as they say in Dagbani, Nantu Biao, may God give us tomorrow. Good night.
Next week, we will bring you a special report from Kpalbe, Ghana's biggest hospital in Accra. It's a fascinating story of promise and challenge, an engaging story that lays bare the essentials of Ghana's healthcare system. Thanks for watching, and good night.